Good morning, my name is Jake Thorne and I am a sheep and goat extension specialist with Texas A&M AgriLife. And today we're going to be talking about one of the greatest issues that faces small ruminant production, not just in Texas, but across the entire world, and that's parasites, specifically gastrointestinal nematodes. So when we talk about parasites, really public enemy number one is the barber's pole worm, or scientifically known as Haemorrhagis contortus. And we're going to talk about some methods for monitoring this parasite in sheep and goats. But to really understand that, I want to take a second here and provide a little bit of background information. I think the best place to start is with the life cycle of this parasite. So it has both a host phase and a free living phase. And that means that the adult worm is in the abomasum of our ruminants, and in this case, sheep and goats. And those adult worms reproduce and they drop eggs that go out with the feces on the grass. That's the free living phase. Those eggs hatch, those larvae develop through a few stages, and then those sheep are going to re-consume them. And so that'll provide a little bit of background about why we're going to monitor and what information we're going to collect from both the feces and those animals to help manage this parasite. Now, what makes barber's pole worm so problematic is that not only does it damage the lining of the abomasum, it consumes blood from the animal, but it's extremely prolific. A female barber's pole worm can lay between 5,000 and 10,000 eggs every single day. And so those populations can really expand and develop into large populations, but also can build up resistance to the products that we use to treat the animals. And so parasite management in sheep and goats is complex, it's complicated, it requires lots of different techniques, and today we're going to cover a couple of those that every sheep and goat producer and county agent should be aware of.
Today I want to visit with you in reference to issues that producers face with goats and sheep. And you know, living in East Texas, we have to deal with the moisture. We are in a high rainfall area, around 45 inches plus, and we have high humidity, and of course those things certainly can cause problems when it comes to worm issues and things like that. The barber pole is one of the worst enemies that our producers have. And so trying to stay on top of that, and I think doing result demonstrations in that area can certainly lend a hand to producers to perhaps look at some different methods and products to be able to implement into their program.
I'm Rob Bass. This is the Just Right Ranch in Palestine, Texas. We raise a registered St. Croix sheep here. They're hair sheep that are extremely parasite resilient. That's why we use them here. We started out with goats many years ago, and the parasite load with our tremendous rainfall here in this area in East Texas, we fought the parasites with the goats forever, and we decided to go with this sheep, and we've been very, very pleased with this breed of sheep. For nearly 800 babies we've put on the ground, and we still don't worm much. So
we're going to be looking at FAMACHA and fecal egg counting actually in St. Croix sheep today. And St. Croix are really the gold standard in our small ruminants for parasite resistance. Breeds that were developed and have experienced evolution from areas where parasites were pretty much a consistent problem year-round, such as our Caribbean breeds and the St. Croix today, really have more natural resistance. They have the immunity and the ability to fight off these worm infections. So today, I actually expect to see animals that are not very anemic and not have very high fecal egg counts, but they're at a stage of production where they're lambing right now. That's usually a time of the year when there's a little bit more stress on the female, and immunity tends to be a little lower during that time. So I'm really interested to look at these results and see what these animals experience. But I hypothesize that we're gonna have favorable FAMACHA and favorable fecal egg count scores today. Okay, we're gonna be comparing FAMACHA scoring and fecal egg counting today. And both of these methods are used to determine worm burden inside of our sheep and goats. But the reality is they measure different things. And so previous research has actually shown that there's only really a modest correlation between FAMACHA score and fecal egg count. And I'll try to describe why that might be. First of all, FAMACHA scoring is a measurement of anemia of the animal. And in reality, there are other things that cause anemia. However, during certain times of the season, certain production stages, and when the environment, such as we're dealing with today, is really conducive to parasite populations, often Barber's pole worm is the reason why our sheep and goats might be experiencing anemia, because those worms feed on blood. Now, fecal egg counting is a little bit different. That's where we're actually gonna look through the feces and count the number of eggs for that species of worm. And that's a little more specific to that type of parasite, as opposed to our Famacha scoring, as I mentioned, because anemia can be caused by different things. Both of these methods, though, are really critical. We think of Famacha scoring more as a measurement of resilience of the animal to worm burden, and we think of fecal egg counting more as a way to measure resistance or susceptibility. And oftentimes that can't be, or that isn't exactly lined up, because we can have some animals that have pretty high worm populations inside of their GI tract, but can really withstand that worm burden. And they might have a really favorable Famacha score, but what could be happening is those worms are reproducing and shedding a lot of eggs out on the pasture. If we look in the fecal egg count, that really gives us a more specific measurement of how many worms, or an estimate of how many worms are inside of that animal. Again, both really critical measurements. They're both free, easy techniques that every producer should know, and we're gonna demonstrate and compare and contrast during this demonstration today. Okay, to make the comparison between a Famacha score and a fecal egg count, we're gonna go through a little bit how to demonstrate the collection of the data that you need. So first thing that we're gonna talk about is Famacha scoring. As I mentioned earlier in the introduction, Famacha is scored 1 to 5. A 1 is an animal that's bright red, and that's desirable. No anemia, that animal's not experiencing any anemia. On the other end of the spectrum is a 5, and that is white. Now, what am I talking about, red versus white? So actually what we're scoring is the inner membrane of the eye. And so there's a special technique, the Famacha technique, to expose this membrane. So what we're gonna do is we're gonna take our hands, we're gonna cover the eyeball, and with the other hand, we're gonna pull down and pop out that membrane just inside the eyelid. And we're gonna compare the color of that membrane to this scoring system. And so when we look here, this U right here is about a 2, maybe even a 1, which is very desirable. So we don't, based off of this information, wouldn't expect her to be experiencing much of a worm burden, but this is good data to collect. Now, the comparison to fecal egg count, we need to get a fecal sample. And so one way you can do that is to go ahead and use a gloved hand and collect directly from the animal. It's important that we collect a fresh sample. We don't want necessarily any hatching of the eggs in the fecal sample to occur before we read it, because that will confound our data. And hatching of that sample, when conditions are warm and sunny like we've got today, can happen fairly quickly. So we either need to collect the sample directly from the animal, or we have to watch them drop that fecal sample, and then we can just go ahead and pick it up off the ground as long as it's clean. That's what I've done here today. I've put that fecal sample in a little plastic cup. I've got a lid on it. I can record the animal's ID on the top of that lid. If we weren't gonna read it right away, we'd go ahead and put this in the fridge. That will inhibit much hatching from occurring until we go ahead and read that sample. We want to do that within about 7 days. And so those are the measurements that we're going to collect for our comparison today. Okay, so outside at the farm, we collected our fecal sample from our ewes. And you can actually take this sample to a vet office or submit it to a lab which will run this information for you. But with a few supplies, you can do this method actually at home yourself. So the method that we're going to use to analyze this fecal sample is called the McMaster method. That's just named after the individual that developed it. And so what you need to run a McMaster fecal egg count are a few things. First of all, you do need a microscope. This is probably the most expensive part of this. However, you don't need a really high-powered microscope. Honestly, some of the lower-end, more cheaper models are perfect for this. All you need is that this microscope has 100 power, and many microscopes reach that. A small food scale is just fine. A few plastic cups, a popsicle stick, and then last, kind of the only real specialized ingredient here is some salt solution. So this is sodium nitrate. It's got a specific gravity that's right in between the weight of the fecal eggs, or the eggs, and then also the solution for water, which allows those eggs to float to the top. Okay, so how we go through this is we're going to take our sample that we collected outside from the animal, and we're going to take 2 grams from that sample. And that's what I've done here already, just to speed things up just a little bit. And so you can see that it's actually a very small amount. So we only end up using about 1 or 2 pellets worth. Once we take that, we're gonna mix that 2 gram fecal sample with 28 milliliters of our salt solution. And there's lots of resources online. We could provide some of those to you to help kind of explain this step by step, but I do think that this is important to show you how all this works. Okay, so once I've got this 28 mils of salt solution and our 2 gram fecal sample, what we're gonna do is we're gonna crush all that up. And that's important because the eggs are inside of the pellets. It happens that our sample today is a little bit more soft fecal material, but most of the time when you have pelleted samples, you need to break those up. And so we really want to make a fully liquid solution. And that's what I'm doing here with this popsicle stick. Ideally, we'd like to keep stirring this, and then we're going to actually let that sit for about 5 minutes. For the purpose of the video, we're going to go ahead and move to the next step, but in general, you'd like to let that sit for 5 minutes, try to get the best solution possible, okay? The next thing we're going to do is we're going to take a little piece of gauze and we're going to strain out the solids. And so I've got a separate cup here that's actually empty, and I'm going to pour this solution into it to strain out the solids. Okay, and those solids can go ahead and you can discard those in the trash where you don't need that anymore. Okay, then pretty quickly after you've done that strain, we need to draw up with a disposable pipette, and we're going to put that on this McMaster slide. And why this McMaster side is specialized is because it has, it might be a little challenging to see, but it has a green grid built on it. And inside of that grid is what you're actually going to count, and what you're counting are the eggs from the Strongyl family of parasites. Haemachus contortus is within that family of parasites. Now, I want to point out that there are other species of parasites that have eggs that are indistinguishable from Haemachus. And so actually we could potentially be counting eggs from a different parasite that affects sheep. However, we know that especially in warm, kind of wet conditions like we experience here in Texas in the spring and during the summer, generally out on the pasture, the vast majority of the parasites are going to be Barber's poleworm. And so with that being said, we just go ahead and collect all the eggs. Or count all the eggs, excuse me. So this slide is what's going to go underneath the microscope, and we're going to count all of the eggs that we see on one side of the grid and all of the eggs that we see on the other side of the grid. We're not going to count eggs that are outside of that exterior grid line. And then we're going to take that combined number, we'll multiply it by 50, and that gives us our eggs per gram. And that will give us an indication of the worm burden inside of the animal. Now, I mentioned earlier on in this video that Mr. Bass runs St. Croix sheep, and they are one of the most parasite-resistant breeds that are out there. So I actually looked through this sample, and I did not see any Barber's poleworm eggs. Now, that's interesting because earlier, when we looked at the Haemachus score, that animal was somewhere between a 1 or a 2, and so there was and well, I'm not going to say it was anemic, but it wasn't perfectly cherry red. And so there might be something else going on that's causing that ewe to be just slightly below perfect in terms of not being anemic at all. And if we think about the stage of production she's at late gestation, there's lots of things going on physiologically inside of her that could be causing that. And so that's interesting. In this case, both of our measurements here indicated that the animal did not have a significant worm burden at all, but they weren't completely congruent on that at the same time. Now, if we had some different animals in a different situation and our eggs per gram was not 0, there is some important things to understand. That generally about 1,000 eggs per gram or 1,500 eggs per gram is what we consider a treatment threshold. So if that animal has an eggs per gram higher than that, they're a candidate to be treated or to be dewormed essentially. But if they're less than that, we don't need to necessarily treat them. Very rarely, honestly, do we actually find sheep that have 0 eggs inside of them or 0 worms inside of them. And a small amount of worms is actually okay. They can withstand that. We just don't want to necessarily get to a worm population that's too high and harming the sheep or goat. So again, this whole process, again, this is the McMaster method. A microscope that's in the $300 range, a very cheap model, is one of your initial investments. But in all reality, the rest of this, the plastic consumables and even the salt solution is very affordable. In general, we consider at our lab that it costs about $2 a sample to run those, and that includes some labor. So it's not a huge cost, but you do have some initial investment. There is a little bit of time. It does take some practice to learn to do this appropriately and train your eye for what you're seeing. I do have some good resources that are available, including this book on parasitology that shows exactly what the eggs look like underneath there. There's other things that are inside that sample that you just have to get accustomed to make sure that you're not counting. But it's very, very doable process. And I encourage you to learn it because I think it's a very, very useful tool. Now, compared to FAMACHA is, it's a different way of measuring worm burden, but it's probably the cheapest. Honestly, you do have to go through a certification process to receive your FAMACHA card. I've got that here. And so what that certification process entails, you can do this either in person or online. You watch about an hour-long presentation that goes through kind of some of the best management practices for parasites, the way to manage your animals most appropriately to avoid parasitism, and then also you can learn a little bit about the problem with anthelmintic resistance, which is a huge, huge issue when it comes to barber spool worm. You watch that 1 hour presentation. You can demonstrate through either video or in person that you can perform the FAMACHA technique, which is where you cover the eye, kind of push down, pull down the eyelid, and expose that membrane. And then this card, once you've gone through that, you can pay $20 and you'll receive this card, which is an official FAMACHA card. And from then on, the process is completely free to you. And so again, both very low cost tools here. There are some differences, but both what we consider pretty low cost, very important parasite management techniques.
So here are the results for our demonstration using the FAMACHA tool. So just really quick to review, the FAMACHA technique is a scale that we score anemia in our small ruminants on. And it's from 1 to 5. And 1 would be a bright cherry red and 5 would be white. And what I'm talking about, the color here, is this tissue color just inside the eyelid of the animal. And obviously a 1 is more desirable because that is a not anemic sheep or goat. And a 5 is the other end of the extreme, very white, and an animal that is in a potentially life-threatening situation. And so we use this tool to help us determine if an animal needs to be treated. Because just as a reminder, it's important for us not to overuse dewormers and treat animals that don't need to be treated because we're contributing to a real problem of anthelmintic resistance. And we want to make sure that our dewormers are still effective. And so again, 1 to 5 is this scoring system. Our 1s and 2s, those are animals we are not going to treat. Our 4s and 5s, absolutely, we are going to treat those. And the decision, though, is actually when the animal scores a 3. And so some of the factors that help us make that decision are, is that ewe or doe or nanny or whatever we're scoring, is there some other stress going on in their life that may prevent them from being able to fight off parasites from an immunity standpoint? If they have a kid, if they're young or they're old, a kid or a lamb, I should say, or maybe they're thin or dealing with some other pathogen. If any of that is happening and that individual scores a 3, we are going to deworm them. However, if they're healthy, they're in good body condition score, they do not have an offspring of some kind, maybe that's an individual that we are not going to treat. And so what I want to show you here is actually a chart of some FAMACHA scores from Mr. Bass's sheep flock. So we have 10 individuals. The IDs of those individuals are on the left side of the chart there. And we scored them at what we were going to consider day 0. And you can see that we have 1s through 4s. And so immediately what we can recognize is that ewe number 1031 and ewe number 1065 that have a FAMACHA score of a 4, those are certainly candidates for treatment. The 1s and 2s, there's a couple of those are candidates for not treatment. And then the decision there is on our individuals that scored a 3. And so I've highlighted in red here actually the 4 sheep that we went ahead and dewormed. And then we followed up with another FAMACHA score on 30 days later, about a month later. And you can see that the actual reduction in the FAMACHA score of those 4 treated animals is a 2.0 in every case. That's really good. Remember, a lower number is better. And so we can see that these 4 treated animals became more healthy and were not as anemic as they were at the beginning of this trial. Now, you might notice that the untreated animals either stayed the same or in actually some cases adjusted their FAMACHA a little bit, but were still within a healthy range. I specifically want to point out this U1026 because we decided, even though she had a score of a 3 at the beginning of this trial, to not treat her. She did not have a lamb at this time, and she was in good body condition score. That helped us make that decision. And you can actually see that her FAMACHA score improved on its own without treatment with a dewormer 30 days later. And so that was a little bit of a proof of concept that we made the right decision by not treating her in this case. She was able to clear whatever worm burden she was dealing with on her own. Now, right along at the same time that we took these FAMACHA scores, we also used another tool that helps us estimate worm burden inside of small ruminants, and that's fecal egg counting. In fecal egg counting, the unit of measurement is eggs per gram, or EPG. And so we took fecal egg counts at day 0 from these same 10 ewes, and you'll notice that the 10 highest egg counts, those came from the ewes that we decided, based off our FAMACHA score, needed treatment. And so that ranged from 2,000 eggs per gram up to 5,500 eggs per gram in some cases. Now, again, I want to point out this U1026, she had an 1,800 eggs per gram. She was the highest of the remaining ewes that were not treated. But again, based off of her FAMACHA score and our expectation of her able to be resilient against that worm problem that she was maybe dealing with a little bit, we did not treat her. And we took another egg count 30 days later, again, when we took that other FAMACHA score. And a couple things. Obviously, those 4 ewes that we treated, they had the most drastic reduction in the fecal egg count. Again, that's a good thing. Across those 4, if you average it out, it's about a 95% reduction. That's what we want to see. That helps us actually also feel confident that our treatment, the products that we use, were effective at clearing those worm populations, and there wasn't strong resistance already built up in this population. Now, if we look at the egg counts of the untreated ewes, again, a lot of them actually reduced on their own or maintain at a somewhat similar level. And when I look at that information, that data from the day 30 fecal egg count, I'm not concerned about the worm burden in any of those ewes, even though each of them have a small level of eggs.
And so one of the times when FAMACHA score can really vary is particularly in younger lambs. And so those are lambs that have not experienced a parasite challenge and are not as resistant breeds. So that would be something that's maybe from European descent or African descent. They can experience they can really start to feel the effects of that parasite challenge and start to lose blood. And so it's really important that we monitor FAMACHA score right at about the time of weaning in those lambs. That might be a time when we need to go ahead and treat those animals because that parasite infection can really develop quite quickly, and we can experience lamb mortality or at least production losses. Now, also at the same time, that's a great time to score our females or the ewes or dams at the same time. And the reason being is, again, in some more susceptible breeds, they're already converting a lot of their nutrients into lactation that lamb is consuming. Peak lactation is in that 30 to 45 day window right before weaning, and not a lot of their nutrients are being diverted towards their own immunity. And their own immunity is what's gonna allow them to fight off parasite infection. And so if there's not much immunity against parasites, they're already a pretty susceptible breed, we need to be on top of that FAMACHA score. We might be seeing some animals that are 3s or 4s, and those might be some animals that we need to go ahead and treat. If we see FAMACHA scores of a 5, which is a very white membrane, that's an animal that needs treatment immediately because they are really experiencing a low pack cell volume. FAMACHA score is a relevant, it's an estimate of pack cell volume. So Barber's pole worm is a blood feeder, and pack cell volume is the percentage of the blood that are red blood cells. And as that blood is consumed by the parasites, those animals are not able to regenerate red blood cells very fast. And if we get below a packed cell volume of 20%, that's an animal that's experiencing anemia. And that converts to a FAMACHA score of right at about a 3. And so that's the time we need to go ahead and treat those animals.